Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. All right, everybody, welcome back. Thanks so much for being with us. Dr. David Musnick, who I'm here with, is a highly accomplished clinician and diagnostician specializing in orthopedic sports medicine and functional medicine with board certifications in both sports medicine and internal medicine. He brings an impressive 33-year background in sports medicine and internal medicine and 26 years in functional medicine, to include diagnostics and treatment in heavy metals. Dr. Musnick's extensive experience has led to the development of his unique assessment and treatment approach, showcased through countless cases. Not only has his work been published in numerous textbooks, he's also a sought-after speaker on various conditions, notably arthritis and concussions, or originating from Boston and spending much of his time in Seattle. Dr. Musnick now calls Idaho his home, bringing his expertise and passion for athletics, outdoor activities, and specialized treatments in our community. Welcome, Dr. Musnick.
Thank you.
Thanks for being here. So tonight, this has been a topic that I think has been really spoken a lot about in even in the last year or two. More and more attention being brought to this topic of heavy metal toxicity. And so why should we be concerned about heavy metals and the way that they impact our body?
Well, heavy metals can harm a person's brain, their nervous system, their immune system. Heavy metals can be the major cause of Alzheimer's disease and dementia. Heavy metals can make it so that someone's more susceptible to an autoimmune condition or develops an autoimmune condition. I'm finding so many people with fatigue and fatigue-related symptoms, which is lower energy, that can be directly related to heavy metals. Neuropathy has been known for a long time when people have nerve-related pain in their feet and legs. And a lot of people think it's just diabetes, but one of the biggest reasons for neuropathy in the legs is heavy metals. And so there's so many things that heavy metals can do to damage tissues and cells, conditions they cause. And you probably know, I've taken a lot of deep dives. 28 years in functional medicine and so many deep dives and learning experiences. And I now believe this is the most important thing we can look into.
Really?
Yeah, I have reasons for this, but I've come to that conclusion over the last 6 months that this is one of the most important factors that are affecting our health right now. Interesting.
And so is it all heavy metals? Which ones do you consider to be the more toxic?
Okay. So, what's interesting is well, I've been looking at this for as long as I've been in functional medicine. So way back when, 26, 28 years ago, we were looking at mercury and lead. And really that's it. And measuring those things because mercury was coming from dental amalgam fillings. Right. And also, mercury's in the air too, from air pollution. But a lot of people were being exposed to it in their fillings. And then, lead was coming from, quote, leaded paint, which we don't have anymore, but it's still in the environment. So we were looking a lot at those two metals. And, but nowadays, there's some other really important metals that we have to look at. And some of them are, very surprising. But the ones that we really have to look at are aluminum.
Yeah.
Barium, gadolinium, and gadolinium is actually from contrast from MRIs. Cadmium, very, very important metal. And now what I would characterize as the radioactive heavy metals, cesium and uranium. And these are just a few of them.
Yeah.
And also including arsenic.
Right. So let's talk about some of the sources of the various metals that you just mentioned. I know water,
right? City
water specifically. I know in this area, I've seen a lot of city water tests from different clients. Cadmium is high.
Yeah.
I've seen that. Arsenic.
Yes, it is.
Is one that's high in our city water.
Yeah. Believe it or not, there's uranium in our water.
And where are these metals coming from that are leaching into our water supply?
So, I would call that multiple ways they're getting into the water supply and the food supply,
right,
and the air.
Right.
So you have to sort of break it down that way and say, well, if it gets in the air, it's going to get on the soil.
Right.
And if it's in the air, it's going to get in the water. And so, but there's other sources, like if you take aluminum, one of the most well-known sources was antiperspirants.
Right. Yeah.
And so that's why I've been telling people for years, don't use an antiperspirant, use a deodorant.
Well, thankfully there's so many, I feel like there's so many different options for aluminum-free, paraben-free deodorants that actually work.
That's true.
There's a lot now.
Right. And so what else? Like, don't cook with aluminum foil.
Right.
When people heat things up with aluminum foil, or they pack things, go to work with aluminum foil, whatever. And then, aluminum coated cookware.
Yep.
And there's many other sources of aluminum. I mean, so if someone said, hey, by doing these things, can I, not be exposed to aluminum? No, you're being exposed to it in the air,
right?
And you're being exposed to it in the water, but you can decrease the amount of exposure. People often ask me, what should I have in my home? Well, at least a reverse osmosis filter.
Okay, so at minimum, that's what my next question was. At minimum, an RO filter.
At minimum, but something called a water distillation system is even better. And I'm at the point, which you may or may not know, where I am actually putting small amounts of chelating agents in my water. I have a reverse osmosis and multi-stage carbon filtration under my sink in my house in Star. And I originally got it because I heard that it could actually filter out radioactive uranium. Believe it or not many can do that. But I'm at the point where I'm putting some drops of chelating agents in there.
What are you using?
I'm actually using calcium disodium EDTA a little bit. So there's so many sources of these metals.
Right.
And unfortunately, no matter how many things you do, the average person is still going to have fairly high levels of metals. And the other metal I forgot to mention is graphene. And it's something we're being exposed to with the geoengineering, with what's in the air, coming from the airplanes. And it's been in the shots, and there's a lot of issues with graphene.
Yeah.
And so each one of these metals can cause different problems. Like just for instance, cadmium. Cadmium is very toxic to the kidneys. And what I've been noticing, like in the past 10 years, is more and more people coming in with what's called kidney insufficiency, renal insufficiency, which means it's dysfunction of their kidneys. Now, these are people that have 2 kidneys. Everybody always just think, well, I'm not going to have a problem with my kidneys. I could even give a kidney and it's not that way anymore. And I'm not telling people don't donate a kidney, but our kidneys are under insult. All of our organs are under an insult from these different things. So what's interesting, and this is just a side note, I've often found like measuring the heavy metals in someone with a kidney insufficiency and then starting a metal chelation program and then doing frequency specific microcurrent to protect the kidneys. I've had nobody go for a kidney transplant.
Good.
I've had nobody go for dialysis. I've been able to preserve everybody's kidney function with this plus some dietary things.
And
but that's just like one metal. That's just cadmium.
Yeah.
Cadmium really insults the kidneys.
Yeah.
Aluminum really insults the
I was going to say, don't majority of heavy metals, can't they all insult the kidney?
Yeah.
Because you detox, you don't just detox your liver, your kidneys are also a really important part of detoxification.
Kidneys are really getting barraged by metals. And remember, metals are, in tissues, and then the kidneys are trying to filter out some of the metals, so they're getting damaged by the metals at the same time.
And for those that don't know, it is literally a like $7 comprehensive or even basic metabolic panel to look at kidney function as a just initial
it's not that much
marker
to look
of
at kidney function.
Kidney function to see if one of those 3 or 4 markers we can look at is
and I think that anybody that's getting, labs once a year or whatever should ask their clinician, okay, hey, what's my estimated GFR? What's my creatinine? Is there any issue?
Right.
I've literally had patients that came in and I looked at that and they were off.
Yeah.
And nobody told them about it.
Yeah. It's kind of the classic, don't take Advil and stay hydrated and you'll be fine. But no one's actually saying what are the other things that insult our kidneys and why is my GFR, my creatinine.
But did you know that the average kidney doctor, if you have kidney insufficiency, they can't really do much.
I know.
Or they don't really do much. They might put you on an ACE inhibitor or something. but they can't do much to preserve the kidneys. And in most people, the kidney function goes down fairly rapidly. So we can do a fair amount about it.
Conditions, we don't really, we'll wait until you become a diabetic, or we'll wait until you have the heart attack, or we'll wait, like no one's really looking upstream and trying to figure out root cause. So yeah, it's not that different than how we kind of manage other conditions and diseases.
But, I also like the brain, and
we know you do.
I think you got to have a good functioning brain. And when you start looking at these metals like mercury and aluminum are extremely toxic to the brain.
Right.
Extremely toxic. And aluminum has been highly linked to cognitive decline. And remember, we're not just talking about, do you have Alzheimer's or not? Because everybody thinks, oh, that's pretty far away. It's like, if you don't protect your brain and take measures to protect your brain, like 6 months from now, hey, what if you have trouble finding words? Or what if your memory's off? And we don't actually have good blood work to test for this.
Right.
I mean, in our clinic, we have a 3-page brain region questionnaire where you can start screening some subtle symptoms of this. But I really think people have to have a goal: keep my heart healthy and my brain healthy and my kidneys healthy and my gut healthy and my hormones healthy. I mean, we have to have targeted health goals.
Well, and it's not just, from my understanding, it's not just also an aging thing that happens as an adult. I know that there's data that links aluminum toxicity from various different shots or whatnot to low IQ in children. So it starts really early. This isn't just something that people that are 50, 60, 70 years old need to be concerned about.
No, that's a good point, because we have an epidemic of brain disorders in children and teenagers.
Mental health issues.
Including depression.
Yep.
Including anxiety, and including ADHD, which is a focusing problem and movement problem. But these things are affecting
everyone.
At least the brain-related issue with metals and other things, of course, but metals, they're affecting everybody. You don't have to be older to have this effect.
No. So it's not just, the rule is no longer just eat organic and drink clean water. That's honestly not enough.
It's not enough.
Because we're being insulted from the air pollution, and what are other sources? So we've got air.
So the
water,
air pollution is the biggest source right now, I think.
Bigger than food and water.
Yes, but the air pollution is going into the food. I mean, it's contaminating the soil, so that when you eat the food, you're getting the metals.
Right.
And then the food, materials we use, the shots, they have metals in them. And so, but I think, in the forest fire smoke we've been exposed to has metals in it. There's a lot, nobody's without exposure right now.
Right.
And what's interesting is, there was a study recently where they took snow from some part of Colorado that was not Denver. I mean, not in the big city. It was some pristine area in the mountains someplace, and they sent it to a lab for analysis. And there were outrageous levels of metals.
Oh, goodness.
And then I know someone who did this, you probably heard of the Priest Lake area. And I know that's supposed to be a pretty pristine area. And they sent rainwater and lake water for analysis. And the aluminum levels were just high enough to cause Alzheimer's disease in people. I mean, very, very high levels that, our exposure to these metals is like escalating.
Yeah.
So, I'm at the point now where I think that the vast majority of people should have at least a heavy metals challenge urine test, and ideally a combination with a heavy metals hair analysis, because what a lot of people don't realize is the hair, as long as you don't dye your hair, will show some metals that the urine metals challenge test doesn't show. And one thing that we're doing here that I at least take pride in is we challenge with 2 different chelating agents. So I feel we're getting really good representative samples, because most places, all they challenge with is DMSA.
Right.
But we're adding calcium disodium EDTA into this. So we're getting a much broader example. And I'll tell you, recently I had my own test done. It's upsetting when you see this and I've been eating organic for years. I'm like one of the purest people on the planet. I have the best filtered water. my lead was high, my mercury was high, my aluminum was high. And it's like, you know, and I know how I'm getting exposed to this, but it's like, if I'm having levels like this, the vast majority of people are too, because like I've been sort of into functional medicine for 28 years and like eating really clean and drinking pure water for a long time. And so for me to have metals like this is like, we're just getting exposed to them, you know, and I feel like anybody with fatigue, anybody with any brain fog, anybody with any brain issues, anybody with a kidney issue, anybody even with an autoimmune issue needs to be tested for metals with the right type of test. And then one thing I pride myself on here is that we will look at these tests and figure out that there's other issues going on, because one of the other issues that's fascinating, which people don't realize, metals are insulting the lungs. So that I have had so many patients lately, they're short of breath. The pulmonologist doesn't know why. The pulmonary tests come back okay. The cardiology tests come back okay. They're still short of breath. And then we put a pulse ox on their finger, walk them around, and they go from what seems to be normal, 97, 96, they go below 90, just walking for 4 minutes fast. That's not normal. And so one of the things that I've looked into and discovered is the damage to our red blood cells, which are, you know, I could say one of the most important cells in the body. They deliver oxygen. And, you know, recently I've been privileged to look at them under the microscope, and they can look extremely damaged. They can look distressed. They can look clumped together, and they can't get through the capillaries to deliver the oxygen when they're like this. So one thing the metals are doing is damaging red blood cells. And, you know, you don't even hear most functional medicine people talking about damage to red cells, but I think that issue, and we also will call some of this oxidative stress damage, it's extremely important. Like I when I see patients, I don't just label what's wrong with them or disease. I say, you know, we have processes that we have to look at, and one of them is, what's the health of your red blood cells? How do we get them better so they can deliver oxygen ideally? And so I think that's another issue. It's another goal, you know, get your red blood cells as healthy as possible so your lungs are healthy and you're able to deliver the oxygen, because what most people don't realize is you have to deliver oxygen to every tissue in your body. Right. Brain, everywhere.
Yeah. No, to keep them functioning well and to feel good and for healing, because oxygen is very healing to the body.
Very important.
Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available, so you can trust that you're giving the body the support it needs. Visit funmedshop.com today and take the next step in your health journey. That's funmedshop.com. So we've talked about exposure and some preventative measures, but I know everyone's going to want to hear, well, what can I do? What's the application at home? So I think, and you're really good at this because I've heard you lecture on this so many times, foods that can help. And I know it's probably not enough, but at least that can help assist the body in detoxification of some of these metals.
Yeah.
I know cilantro is one of them. I know you love parsley for the brain.
Yeah, so let me talk about cilantro for a second.
Great.
Which
I knew you would.
Something. Yeah, so cilantro has some interesting characteristics, especially regarding detoxification of mercury. Yeah. And so one thing people can do is, you know, you can add cilantro leaves to whatever. You know, and you know, when you order food, and if there's a possibility of getting cilantro, tell them to load it with that. But I would tell people, you know, make a cilantro pesto, because then it's really concentrated. And I mean, the best way to do it is, you know, use organic olive oil, and then whatever nut you want, whether it's pine nuts or walnuts, and then like literally at least a whole head of leaves, and put it in there and really blend it in, really turn dark green, and then put some basil leaves in to make it taste good. And then sometimes, you know, like in you know, like I have a little pesto maker, Hamilton Beach, it's glass.
I know you brought it as an elephant gift to a Christmas party once. I won't forget that.
Oh, wow.
And you taped the recipe to the side of it. It was a great gift.
Yeah.
I loved
That
it.
is an incredible gift. It's hard to find a glass pesto maze. They're mostly plastic.
Well, you brought one. You found
That we're not, sometime in a podcast, we should address microplastics. Because I just heard that they've been biopsying brains of people with Alzheimer's and other things and finding enough plastic in a person's brain to equal a plastic spoon.
I know. And talk about the exposure is literally everywhere of these microplastics.
But in terms of the pesto, let's go back to the pesto. Helpful.
Yeah.
So you sort of mix enough basil to make it taste like basil pesto.
Right.
But you put a lot of the cilantro, organic cilantro in to have the detoxification properties, and you just put it on you put it on toast, like you can make like a detox toast,
as long as it's organic and probably gluten free.
So you have your toast, and then just smear the pesto all over it, or you can make avocado, an incredible detox thing. You know, you've heard of avocado toast.
Yep.
Well, but put the pesto on first, then the avocado and broccoli sprouts, because broccoli sprouts with sulforaphane. Have some detoxification mechanisms.
And those are so easy to make at home on your own.
Right. So that's like an incredible detox toast.
Right.
Right. And so, but you can put the pesto on fish. And the other thing I would recommend is when people eat fish, take some chlorella with you.
That's a good idea.
And we have a particular brand at the clinic that we like, but I'm telling people, you go eat fish, 15 to 20 of those little green tablets right after that meal or during the meal to bind the mercury in it. But
how about chlorella to help bind some contrast agents if someone's going to have some diagnostic testing done?
I see. Contrast agents usually fall in the category of iodine contrast agents, which I think are a lot safer.
Yeah.
And gadolinium. And the problem with gadolinium is it's a heavy metal, and certain forms of it. None of the forms completely leave the body after you do the contrast.
Right.
So it goes in the brain or someplace and it stays there. Some of it comes out, but a lot of it stays there. So I say to people, look, if you don't need contrast, do your MRI without it.
Right.
But I don't know a way of the binding of gadolinium is very complex. There's some very special chelating agents to try to do it.
Right. Okay, back to the food, because I do think it's important. People want to know what they can do at home tomorrow. So we've got cilantro pesto. What other kind of foods can people be consuming a lot of? I know staying hydrated as well. Broccoli sprouts. Yeah, you mentioned that.
You can even put broccoli sprouts in the pesto maker.
I throw broccoli sprouts in the smoothies I make for my kids.
Yeah, you can do that.
Yeah.
I mean, you could put chlorella in a smoothie.
Yeah, that's true.
But chlorella doesn't taste very good.
That's easier just to take.
Yeah.
So what are foods we want to make sure we avoid? So you said something about fish, which reminded me of fish that are higher in mercury.
Yeah,
we need
the
to
bigger
avoid
fish.
Large fish.
Bigger fish, and it's not just mercury. They're accumulating all kinds of metals in the ocean.
In the ocean floor, yeah.
So even halibut, tuna, those are known to have lots of metals. And so people need to stay with smaller fish like trout. But the other issue is like shellfish, like shrimp, scallops. They're at the edge of they're highly contaminated with metals too.
Yeah.
So this even brings up an interesting thing. Did you know that that a lot of people take glucosamine sulfate for their joints, but the average glucosamine sulfate is from mollusks. So we have a glucosamine sulfate here that's not from mollusk shells, like clams or whatever. It's from non-GMO corn. It's much cleaner.
Right.
So one time, like years ago, I did a calculation about how much lead and mercury someone's going to get if they're trying to support their joints with glucosamine sulfate. So the other thing is, did you know that some Indian herbs like turmeric are contaminated with heavy metals?
This is why we just can't preach enough the importance of good quality, clean supplementation.
Right.
The amount of clients that come in on supplements from, I won't name brands, but from your local Walmart, Walgreens, Costco, Amazon, be so careful, because it's such an unregulated industry.
I know.
And it's just really concerning what people could be taking, and they think they're doing so good, because it's not something that it's not like it's a fish that you're only eating every 2 to 3 weeks. You're consuming that one 1 to 2 times a day, that supplement, sometimes more.
Right.
And so it's really important to pay attention to those things.
Yeah, and you want to make sure any fish oil product it says that it's verified and tested.
Fish
for
oil
heavy
could be
metals.
so dirty for the reason we just talked about.
But I've sort of found out recently that some of the companies, they haven't been doing heavy metal testing for 2 to 3 years.
Oh, I know.
And sometimes
Probably because it's hard to get a clean
sometimes
product.
a bigger company buys the smaller company and then
Right.
they're not doing the testing anymore.
They don't have the regulations.
Yeah, but Amber, I wish I could say that just food could do the trick.
No,
but,
I know.
But we need certain supplements, and as far as I'm concerned, there's a major role for IVs for this.
Yeah, and this is definitely where I want to go next. And I know you've been really like truly pouring your heart and soul over the last. You've been talking about it for at least 6 to 9 months. IV therapy protocols to help assist the body with getting some of these metals out.
Yes.
And we're about to launch an IV therapy protocol here at our Eagle FMI location to help do this. So talk to us about how IV therapy can really help the body detoxify some of these metals. And when we're detoxing these metals, we're also helping the body to detox other chemicals as well. It's not like it's only helping to get metals out of the body. So there's vast benefits that come.
Yeah, that's true. So it turns out that, if you say, okay, if I want to get a product, a detoxification product, I want to get something that's going to bind onto a metal tightly, but it's not going to be just a binder. It's got to chelate that metal. So,
and what does chelation mean for our listeners?
So, we talk about, say, binders for mold biotoxins,
which helps to grab onto the toxin and
put
push it out of the
in
body.
the GI tract and poop it out. But chelating agents can do their job by tightly binding to metals, and then they're eliminated either through the kidneys, through urine. We know they're eliminated through urine, or stool, or both. So chelating agents are stronger than binding agents. And a lot of these have been extremely well researched. Some of them are oral, but the ones that we're talking about administering IV, it turns out that EDTA has been used for a long time for sort of cardiovascular disease, but it turns out that, the type of EDTA that was being used was trying to bind calcium. Well, we don't want to bind calcium with it now. What we want to do is we want to chelate the metals.
Right.
So the appropriate type of chelating agent is called calcium disodium EDTA. It's got calcium in it, so it doesn't deplete the body of calcium. And we're using it specifically to chelate certain types of metals. And as far as I'm concerned, it's very good for lead. It's very good. It's reasonable for aluminum, not terrific for aluminum. But the combination of calcium disodium EDTA and just what I would call low dose IV vitamin C, 10 grams, run together, because you can actually put 10 grams of IVC in with the calcium. You actually push the calcium disodium EDTA in. Can bind a lot of metals, and it does some other things. It really helps the red blood cells. It's remarkable. When you see a microscopy slide of these distressed, damaged red blood cells all clumped together, and then, like after a few, maybe 2 to 3 EDTA IVs, and you look at, then you see it, it's like the red cells look actually normal.
Yeah.
And they're not clumped together, and you go, that's so good. The other things that are really helpful are IV alpha lipoic acid, which is a really important antioxidant, and IV glutathione, which is an important antioxidant. And then we have a program here that I've devised with certain oral agents to support this program in between that are going to deal with graphene. That's going to have certain doses of vitamin C, certain doses of the oral calcium disodium EDTA to complement this program. Because you have to, and the other thing you have to deal with is microclots and some other things that are going on. So I really think that the IV program is important, because I wish I could say that orals get into the brain at high enough doses, but I don't think they do.
Yeah, the intravenous route is necessary.
Yeah, we got to get them everywhere. Literally every compartment of the body. Intravenous will do that.
Well, and we talked about on a previous episode regarding IV therapy too, the issue with oral supplementation, especially in this case, is the gut microbiome is now so distressed because of the stress of heavy metals and our stressful lives that we really worry about absorption issues as well with these oral supplements. So intravenous also is really an A+ game plan.
Well, plus the amount of, say, calcium disodium EDTA you need. It has to be liposomal.
Yeah.
It can upset some people's stomach and their gut. But I would say, and I've had the treatment myself. It's not that bad. It's
well tolerated.
I mean, I tolerate it well. I've known a lot of people that had it well tolerated. If you do it correctly, it's well tolerated. But I think we're going to see a lot of results in terms of improved energy and just all kinds of long-term results. But I think with the amount of levels of these metals I'm seeing in people can think of, okay, I need to get assessed. I need to get started on an IV therapy program. And then we'll tell them approximately how often you need it, what to do with the orals. And it's just going to be a part of like wellness.
Absolutely. Preventative health.
Not just diseases, but preventative, but also, targeted to diseases. Because, as far as I'm concerned, if someone's got an autoimmune condition, Parkinson's, MS, and they've got high loads of metals, we have to approach it with the metals and other aspects of functional medicine.
So if a client's interested in seeing their heavy metal burden and interested in these IV protocols, they essentially need a consult with you, which establishes care, and then they can get the heavy metal testing done and then get started on the treatment as soon as they can.
Then they get a whole program laid out in terms of, okay, because as you remember, we may put them on some actual chelating medications.
Right.
Like we do use something called DMSA to provoke. DMSA may be part of their program, especially if they have high mercury levels. I mean, there's actually oral DMPS, which is good for mercury. But because these agents work on different metals, it has to be a pretty refined program of, the calcium disodium EDTA with the vitamin C. It's going to be a center of the IVs, along with the alpha lipoic acid and glutathione. But there will be for each person individually tailored programs with chelating medications and supplements to say, okay, this is going to be a complete program.
I'm so thrilled that you're going to be offering that. This is so exciting. So you've made it very clear that this applies to everybody. Yeah. There is not just one person that shouldn't be at least aware of the situation of heavy metal toxicity.
Yeah. It really does. I mean, even people with undiagnosed headaches, brain fog.
Headaches is a good one.
Fatigue, ADHD. I mean, there are so many conditions that it's just like, if someone says, look, I've got this chronic condition, I'm not getting.
What about anxiety, insomnia? I mean, you said how it affects the brain. So I'm just thinking panic attacks, anxiety, depression, chronic brain fog.
Yeah. So this is fascinating.
Concentration.
Did you know that we can do EEGs in the brain?
Yes.
But there's something called QEEG, or certain ways to measure voltage from different parts of the brain. And if certain parts of the brain don't have enough voltage because of the heavy metals and the electrons being taken out, people can have anxiety and depression that will not respond well to medication. Or, so I mean, there's so many, I think, mood disorders that can be related.
Or even we've been talking a lot about this in our new weight loss program, weight loss resistance, right? You can't lose weight, or you lose weight doing some really strict regimen for 3 to 6 months and then it all comes back. Or you take a GLP-1 and lose weight and it all comes back, right? Yeah. And that's when you have to start looking at these hidden toxicities in the body.
I totally agree with that.
So we run these toxicity tests on our clients that are now engaging with us for metabolic weight loss.
And some people might say, okay, well, what if I just do sauna? And I say, you know what? Sauna is generally good. But it doesn't get rid of most metals.
Yeah, I would agree.
It's pretty good for certain chemicals,
right?
But it doesn't do the trick for most metals.
Because it's not a chelating agent.
Yes, and when they measure what's coming out in the sweat, it's not like massive amounts of metals. It's more some of these chemicals. That
environmental toxicity.
So it can be part of a detoxification program, but it's not going to do the trick for the metals.
Yeah, no, I would agree with that. Thank you. There are so many wonderful nuggets of just wisdom and knowledge and awareness. And it's not, we're not trying to be an alarmist by any means in this conversation. Our goal is just to provide that awareness and that education, so that our clients, especially those that have been suffering for so long and not feeling heard by their, conventional medical provider, institution, whatever that may be, that there could be answers and something that hasn't been tested before. And I think turning to these heavy metal or just any kind of toxicity is a really good place to turn if you've been struggling for a long time.
Yeah. And it's not like any place in the United States is going to be less than some other place, unless you live near a factory, of course, that could be an issue. But
well, we have a lot of agriculture in this area though. And we know that these things in the air, these particles can travel far. So that's, our area is not at all.
Oh, here's one other point I just forgot. Sorry.
Another, did you know?
You asked me about food.
Yes.
Yeah. A while back, the information came out about arsenic in rice.
Yes.
And
in chicken.
In chickens. Chickens are being shot with arsenic to get a pink color.
I know.
And so you got to go with the organic, chickens with organic feed. And you want chickens that move. There's some areas that were not sprayed with arsenic containing pesticides.
Right.
So Lundberg farm rice was supposedly much lower arsenic than rice from other places.
Agreed.
And I forgot to say, one of the major places where people are getting exposed to arsenic is rice.
I know.
I went to the Rice Asian today in Eagle, and I'm seeing everybody ordering these, these rolls with all the rice.
I told you can't keep just eating conventional meat and rice, Dr. Musnick. We preach this stuff all the time.
I don't get meat there. I get vegetarian.
Did you
dishes.
ask if they serve Lundeberg rice there?
I get vegetarian dishes, and I don't eat rice there. But anyway, I was just commenting that I saw this teenager with I said, wow, that's really beautiful. What are those sushi rolls? And she goes, oh, there's 2 of them. And they were this long each. They were filled with rice.
Yeah.
She's been exposed to a lot of arsenic. People don't realize that. So
no, they think they're eating healthy. And
they can make healthier choices, even in regard to which rice they're eating.
Right. No, I agree. So guys, cilantro pesto it is for the rest of your life. Sorry.
And let's get the metals tested in you and
get the metals tested.
Get you on a program.
Yes. No, I agree. Thank you so much. Thank you so much for tuning in. And we'll see you soon. Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.